Okay, John Peacock has checked in. I see Jeannie Seabold. Hi, Jeannie. And we got one. Is Tori attending?
I assume so. Yeah. I haven't heard otherwise.
I know Billy Matson will be late. I just ran out of a budget meeting to do this, and it was still going on, so he was getting ready to leave. Okay, there's Larissa. Jordana's coming on. Got 1, 2, 3, 4. Oh, Brett's coming on, okay. We will have quorum once Brent comes on, but the number of alternates are here. Hi, Brent. We're going to wait one more minute. Suzuho, do we have quorum now?
We do, yep. You can get started whenever you're ready, Marky.
Okay, we have a very packed agenda today, and I've asked Suzuho to help me stay on track. So with that said, be prepared that when I get a signal from Suzuho, we need to end the conversation. We will need to end the conversation. Got a lot of guest speakers. We've got a lot of items that we do need to discuss today. So let's go ahead and get started. I'll call the meeting to order. We have established that we have quorum, and I will then move us on into the minutes of the previous meeting. Do I have a motion for approval?
So moved.
Thank you very much. Do I have a second?
I'll second.
Thank you, Ann. All in support, just raise your hand. Okay, we unanimously approved. Okay, next item on the agenda, Suzuho, is it the executive session?
It is, yeah. So it's an approval of the agenda, which includes us transitioning to an executive session at this time. So we'll need a motion to transition to an executive session.
Okay, and I will do that shortly. I'll see if there's any changes to the agenda other than, if not, any additions, any deletions? Okay, if not. So therefore, let me read this to you. Do we have a motion to move to an executive session to discuss the negotiation of COVID-19 testing and equipment from third parties pursuant to CRS 2464024E? I will need to have 2/3 of a quorum of you to approve it. So first I'll ask for a motion to move into executive session. Thank you, Greg. Do I have a second?
Second.
Thank you, Linda. All in support, we will need to take just raise your hand and hold them up so we can document it's unanimous. So all board members have approved. Okay. With that said, we're going to now, you'll have to go in and sign back in to a second Zoom. Does everybody have their second Zoom?
Yeah.
Okay.
Yeah. So leave this meeting and go into the other one.
Yes.
Okay.
Correct. And if viewers want to stay on this line, you can, but everyone else in the executive session will switch over and we'll come back to this.
Wait, what?
Terminate to a new Zoom meeting. I've got the.
Brian, you're cutting out a little bit. Can you say that one more time?
Yeah, I'm not familiar with this procedure, but I'm going to close this up. I've got the password, I believe. That should to that Zoom meeting is different.
Correct. Yep. So you would sign off of this and hop onto that other one.
Well, but I mean, is the address the same and the password different?
No, it's a different link. So Lindsay, I can forward it to you as well. Lindsay should have forwarded you or emailed you a separate
She
link.
probably did.
That's okay.
But Suzuko, so we leave this meeting though, right? Close out?
Yeah, you close out this one.
Okay, perfect. Thanks.
Yep.
Okay, well, once I do that, I'm not going to be anywhere. I want to make sure I know where I'm going.
Yeah, Brent, I'll just put this in the chat here directly to you, and then you can copy it and put it into your browser after you close out of this one.
I can't believe I made it.
How about that, Brent?
Congratulations.
Yeah,
You're going to be a really super user before long on
I don't
this.
think so. You can't believe the last 10 minutes before every meeting, I just like, and then my internet goes out. It's crazy. Anyway, sorry.
Okay,
I have the same problem, Brent. I confess, I'm feeling quite I'm a Luddite here when it comes to this. But
Yeah,
we're all going to be
exactly.
super Zoomers
Yeah, exactly.
as opposed to super spreaders.
Super spreaders,
I
yeah.
hope.
okay, I'm waiting to make sure I have quorum to resume. Suzuho, do we have? I see Tori's chair.
Yep.
Okay, we do have quorum. We will now reconvene the Board of Health meeting. And I welcome everyone who is participating and listening today. I see we have about 32 participants, which is a very good showing for our Board of Health meeting. Very exciting work that is going on. So to that end, I'm going to turn it over to Suzuho, who's going to talk about our next agenda item, which is very exciting, and it's called testing. Suzuho, you want to take the lead here?
Yep, and then if Lindsay or Raleigh could share the slide deck, I'll work off of that. All right, is everyone able to see that? Perfect. So I'll go through this pretty quickly. I know we're a few minutes behind schedule already. Just wanted to remind you all of kind of what our public health goals are related to testing, and then present a summary of some of the strategies that we've been discussing. So again, you know, public health isn't necessarily administering COVID tests. It's really our role to ensure equitable and adequate symptomatic testing, and limited screening for asymptomatic testing is available to anyone within our community, barrier-free. As you might recall, some of the testing strategies that we had all agreed to when Charlie was here, it was the last thing that he presented before he had to leave, included hiring a full-time testing coordinator, which I'm really pleased to share that the BoCC approved through an emergency resolution to provide a supplemental appropriation to the 2020 budget. And so we did get permission yesterday to move forward with that. So thank you to everyone who supported that process. We'll be posting that today or tomorrow. So if you know anyone who might be a good fit for a testing and vaccinations coordinator, please let us know. Some of the other strategies that we discussed in that overall plan that we developed a couple months ago was to ensure that everyone has equitable access to diagnostic testing, ensuring broad bilingual and bicultural communication of everything related to testing, facilitating testing for individuals at higher risk of disease transmission. So this could be because of being in the jail, people experiencing homelessness, any of those sort of congregate settings that we've been talking about, and to evaluate and adapt new testing methodologies as they become available. We know that, you know, every week it seems like there's a new test that's coming out, and really our primary goal is to find the best test that fits our box it in strategy. So quick turnaround times to get test results, as well as minimal barriers in regards to you know, the physical impacts of a test. So figuring out what are some kid-friendly tests instead of the nasopharyngeal type of tests. So with that, some of the barriers that we've been hearing a lot from community members is, if you can go to the next slide, there's requirements for a physician's order, kind of geographic inequities in regards to where our testing sites currently are located, limited testing capacity, which results in waiting times for those tests, so delay in getting people scheduled. delayed test turnaround times, which unfortunately, we have a little bit less control over, because if you're sending a test to the state lab is the one that determines that turnaround time based on their capacity. But what we do have control over would be, can we broaden the number of labs that we work with so that we can strategize where we send our test results, or not our results, but our samples or specimens, so that we can ensure a quicker turnaround time. Other barriers include accuracy of the test related to sensitivity and specificity, and limited staffing capacity to coordinate all of this for the variety of folks that come in and out of our community, including residents, visitors, second homeowners, commuters, and things of that nature. So really, our team has been working tirelessly around this, and huge thanks to AVH, John Peacock from the county, and SKICO, and many of our other partners who've really been a part of this, developing this strategy, who have helped think through these barriers and how we might be able to come together as a community to address them. So next slide. So the approach that we've been wanting to take is to make sure that we have a multi-organizational partnership, so that there are various perspectives and considerations that are brought to the table in regards to how to address the barriers as best as we can in the way the community is experiencing them. Having this, whatever additional testing resource that we're able to bring to the community, be a supplemental testing support rather than replacing anything that currently exists. So this would not replace anything that AVH or Mountain Family or Mid-Valley Family Practice or any other testing site is currently providing. We want to make sure that they are able to serve people with and without insurance, so that being uninsured is not a barrier, and to meet the need that we have here in the community. And some rough estimates, we're looking at about 22,000 tests a year to meet the capacity that we're needing to meet the Protect Our Neighbor indicator, which is 150 tests per 100,000 people. And to really address all of the barriers that we just talked through. So really excited to talk through this approach, and what we're able to discuss here is that there's been some movement in the conversations we've had with various employers here in Pitkin County, and taking on a multi-organizational partnership for testing that would increase access to safe symptomatic testing sites in Pitkin County. We're hoping for at least 2 locations, one Mid-Valley and one in the Upper Valley, not requiring a physician's order for people to come to either of these testing sites, increasing capacity through best practice logistics, and really being able to streamline this through some sort of drive-through testing, leverage economies of scale, again, by being able to provide community-wide testing to anyone who is symptomatic and needs to be tested, enhancing communications and tracking through technology to help improve our efficiencies, and notifying people more quickly of their test results and needing to isolate or quarantine, and then conducting some public health recommended asymptomatic testing. So again, this includes sort of the congregate setting type of tests, and then pursuing existing and emerging testing modalities to assure the most timely and accurate results. So we will continue to have the negotiations with various vendors to see what might be the best fit for our community, but these are the steps that we've been able to take since we last met a couple of weeks ago, to try and bring additional testing capacity here to Pitkin County. And then in addition to that, there's a few other things that we wanted to briefly touch base on. So we had mentioned the curative tests a few weeks ago, maybe a month ago now. So we have received those here in Pitkin County, and are working through a distribution plan for how we can best utilize those. Again, those are meant for symptomatic testing, and to prioritize individuals who may have barriers to testing, whether it's folks who are uninsured, lower income, or any other barrier that they may experience to access testing in our current systems. And then we also just heard this week that CDPHE is going to be distributing some Binax, Abbott Binax Now tests as well. So we're waiting to hear exactly what their distribution plan is around those. they're finalizing, we had another meeting this morning, they're finalizing the plans around that. So hoping to hear the exact quantities that we'll be getting, but they've shared that about 20% of their stock would be shared with directly to LPA, local public health agencies. So that's another promising supply of testing that may be coming to our community. And then I'll turn it over to Kim and Dave to talk about some other testing opportunities through our multi-pronged approach to testing, and then we can open it up for general questions to the three of us.
Great, thank you, Suzuho. I want to stress that I think the best solution and everything that Suzuho outlined is going to be the best way to approach increasing testing in our community, and we want to do it in a safe way, and really a multi-pronged approach, which I think Dave first coined in terms of this, that there's not going to just be a one site that fits all. There's going to be multiple sites and multiple access points, and they may have different targeted audiences, that this is coming down the pike, and we're working very, very hard at this, and hopefully very soon we'll have a lot more of these testing sites. Dave, do you want to mention from your end what's going on, and then I'd like to talk about another venture that I'm working on.
Sure, and thank you, Suzuho. Really nice job introducing and describing a lot of the effort that's been taking place, and a shout out to our Pickens County Public Health team and John for pulling together this multi-pronged approach and with multiple community organizations. For AVH's part, we're going to, as Suzuho said, we're going to continue the services that we have with our Respiratory Evaluation Center and our community testing, our physician referral testing. We're continuing to provide a large volume of these tests, increasing even over the past couple of weeks. But we heard and understand the need to reduce that barrier of a physician order. For some, it's real. For others, it's perceived, but it can slow down the process, and it can be, and it's something that we agreed needed to be reduced. So on our team, Alyssa Franklin is our director of our primary care practice and all of our COVID operations. And she has been, for the past, actually a little bit more than a couple of weeks, working on a new model that we expect to be able to roll out in a week or two at the most. And that will be a additional site in Basalt for us to be able to offer symptomatic testing and testing for individuals that have been exposed or believe they've been exposed. And she's been doing a lot of research into the best practices about how to approach this model, including looking right over the hill at Avon. I think we've heard some of the work they've done with Colorado Mountain Medical. And so we're putting together all the pieces right now, but the basic description of this will be the ability for anybody, and we're really targeting residents of our valley. That's really our target market, so to speak, with this. But anybody will be able to email a site that we are establishing and enter their symptoms, or if they believe they've been exposed, to provide some explanation about the timing of that, because as this group knows, it matters. You want to be tested after 5 to 7 days following the exposure, and then we will set up an appointment, and they can just come in and get tested free of charge. We will bill insurance if they have it, but there will be no cost, as has always been the case. That's not new. To the individual. One of the advantages we'll have of being able to have the symptoms identified up front, and again, this is the best practice that Alyssa has observed, is we'll know which test to use. We have different kinds of modalities that we can use, and we'll want to make sure that we use the right one. And if somebody is severe, they may be a better candidate for the Respiratory Evaluation Center or our primary care practice. We want people to get the health care they need in the process. And then that in the process we're creating, we will also have the ability to follow up with the individual with their results and explain what the results mean, and importantly, what sometimes they don't mean in terms of the potential for false negatives. You still need to stay home and isolate if you have symptoms, whether or not you have a negative test. So once again, we expect to be able to roll this out in a week, most likely 2 at the most. It will be an additional site. It will be in Basalt. And what we're going to attempt to do is complement Mountain Family Health Centers that already has testing, as well as Mid-Valley Family Practice, and not overlap, and try to have each of our services available on different days to comprise 5 days a week. On the weekends, the hospital will still be a testing option, and then also the new model that we are working as a community and multi-organizational approach to establish up here in Aspen. So multi-pronged, multiple options for people so that nobody should have a reason that they can't get tested if they're symptomatic. That's what we're trying to achieve.
Thank you, Dave.
Great.
We're a little bit over on our testing strategy. I'm going to see if there might be any questions, very quick questions on Dave's presentation, Suzuho's, or Kim's. I don't see any hands. Suzuho's, are there any hands going up?
I have a hand up.
Patty?
I have 2 hands up, actually. I'll be really quick. Marky, this is what I talked to you before the meeting started. This is just food for thought. With our upcoming flu season, we might want to consider doing flu testing in conjunction with, not to throw something else, in conjunction with COVID testing, because the symptoms so mirror each other. Then we could rule, if we rule out COVID or rule in the flu, it's just a thought, maybe just food for discussion further as we move down the line. Thank you.
Kim, your thoughts on that and any other discussion on relative to testing?
Yeah, great. Thanks, Marky. And Dave, AVH, and Alyssa have done so much work on what Dave Ressler has presented. I wanted to thank them on that end for providing another site. I just want to let everyone know that I'm working on an additional option and site that would be targeted towards people who are asymptomatic, meaning no symptoms, to provide an option in the community using what has been becoming more popular across the nation of a pharmacy-based model. And so I'm working on that, and hopefully in the next couple weeks that may become available to the community. Again, this is another way to increase access, decrease barriers. And I just really want to note that this standing order, which may be my standing order, is not a substitute. It's really important. This is not a substitute for a physician's visit. So in any testing site, if there's a standing order which is there to decrease this barrier and really increase access to testing, if anyone gets a positive result, it is very important that you then contact your doctor, discuss if you have any symptoms or develop symptoms, and get advice and evaluation. The standing order is not a substitute for a physician visit. It's a really important point. I think we would set this up in the safest way possible and make this available to both visitors and residents, and there will be more to come.
Back to Patty's question, Kim or John Peacock or Dave Ressler, would we be also looking at flu testing in conjunction with the COVID testing? I see Dave's head going up and down. I don't know if Peacock's still on the.
I'll take a first stab, and then Dr. Levin can speak to it as a physician. For our purposes, yes, we have multiple testing modalities, some of which are in one test for different viruses. As a matter of fact, our rapid testing here at the hospital is being updated to include flu automatically. But that will be available depending on the symptoms. So the physician can order whatever kind of test they want. And the process I just described for our basalt location includes the patient entering their symptoms so we can decide which is the best test for them if we suspect other viruses.
Thank you very, very much, both Kim and Dave. Any other questions from board members? Yeah, Brent?
Yeah, just real quickly, regardless of how we go forward, I think a big component for me anyway is to make sure the public is really, really aware of these alternatives, either through social media or even through, a blast through Pitkin Alert, because people are reluctant to, at least I know a lot, that are reluctant to go to their doctor, and they're late in deciding what is severe and what isn't. And, they're optimistic, say, hoping for the best. And I think that if the average person knew immediately where they can go, and they also even knew the cost, but ideally where they can go, that is going to encourage some marginal segment that might not have gone otherwise. Anyway, so I just think that whatever we do, the social component, or in terms of marketing or advertising, is important.
Thank you very much, Brent, for that comment. Greg?
Yeah, very briefly, just when Kim talked about the standardization that she's seeing through pharmacy models nationwide, it makes me ask the question, and we'll have winter planning on our agenda coming up, so this question might be for winter planning as well. But I'm thinking about our visitors coming here. Is there any way we can indicate, share, invite, or cajole them or require them to have some testing or evidence of testing through an affidavit that they provide us before they come here? So everybody's on the same page. And it seems to me that as we start looking towards standardized practices for this, there may be a component of this that could be set up and ready for that. In getting people who are coming here to have gone through a similar sort of program in advance. Just bringing it up, I'm not sure how that would flesh out, but I think that's important for our winter tourism influx.
Well, we did hear back from the governor's office on this particular issue about a statewide strategy. It didn't seem that it really stuck. And Suzuho was shaking hands. We were not successful on that as of yet. But let's move on to see if there's any other questions, Kim, and then I got to move on. Yeah.
Okay, just want to respond to Greg. Thank you, Greg, for bringing that up. There's going to be some conversations about that possibility and what type of options there may be here. A county can do that, even though the state is not doing that. Hawaii and Maine are doing it successfully, and just wanted to let you know that there's some ongoing conversations, so thank you.
Thank you.
Okay, let's move on to our communication strategy. Emphasis here is on Halloween.
Hello, everyone. This is Tracy Truelove with the Pitkin County COVID Communications Team. Thanks for having us today. Really, we're going to actually touch on several things I just even heard you speaking about, which is several campaigns that we have out right now. And I'm going to be joined today by Virginia McNillis and also Larissa Dandino. She's going to actually hit on Halloween. So if you could take me to my next slide. One of the things I thought before I even launched into that, though, is it's been a while since I've updated the Board of Health, and I think it might be important to just share with you kind of how the team has evolved, if you will. So you know that when we were in the initial response in the spring, we were in a joint information center kind of set up with about 12 to 14 people at any given time that were on our team. Well, we've really kind of morphed into what I'm showing you right here now, which is led by Phyllis Matthijs and Kara Silbernagel for the county. And I sit in the role still as that public information officer, lead comm strategy with some help from Rachel Brenneman. Carrie Fleshman on our team is still working from the IT perspective, and Michaela Higgins is doing a lot with our newsletter and our website. We do still have Nick on our web team. We have Gina Sheldrake doing graphic design, and then we've got a robust translation team at the county that's working with us. And then Charlotte, who kind of keeps the wheels on. But I think one of the things I wanted to point out in this structure is these folks, a lot of the county folks in particular, are doing their day jobs on top of taking on a comms piece of what we're doing in the COVID response. So I just can't say how grateful I am for all of them. And again, the added work and attention they're putting towards COVID communications. So if you'll take me to my next slide. One of the things the team that we've tried to morph to also is getting a little more strategic instead of reactive. Now, that doesn't always become very successful. I feel like I've been in a fire drill all week with messaging and information around COVID. But one of the things that we're really looking at for communications is what is the community value, and finding out what our community says they need. And for example, when Brent was just talking about, would it help to have text alerts? We're looking at if there's tools to add to our toolbox, and I'll get into that a little bit more in a minute. We've really gotten more robust on our regional collaboration with Eagle and Garfield County, and you're going to start to see a lot more information from all three of those counties coming out together. Also, we're working on our expectations and agreements across all the functions that the counties touched by and our municipalities are touched by with COVID. And then also we're working on kind of protocols to make things run a little more smoothly. And we're still learning in that, and we're still kind of getting to a place where we're figuring out, what the working agreements are and the expectations. And I think Board of Health even plays into that conversation at some point today when we get to that. Go ahead into the next slide. All right, I am actually going to kick it over to Virginia McNillis to let her talk about what we're calling the Healthy Winners Task Force, which is actually a really exciting, in my mind, collective of us getting collaborative around visitor and guest facing information this winter. So Virginia, take it away.
Thank you, Tracy. Can you guys hear me? Okay, great. I'm actually on 2 Zooms at once, so I'm doing my best to multitask here. We had worked together in the spring on the task force to make sure that we were getting the messaging out to the community about, keeping everyone safe and healthy. So we're actually on a task force call right now with a creative agency, and we have 3 key goals. It's to, in bringing together all of these entities having to do with keeping our community safe and healthy. What we are doing is trying to create a logo or mark that basically communicates that the information coming out to visitors and locals is from an official entity that is unified between all of the task force members that you see here. The second is to create a health and safety guideline that information that is going out through strong design and strong messaging, and it's consistent and compelling. It's consistent across all of these entities. So you will see the same signage, let's say in a on Mountain Restaurant, as you will in Snowmass Village, as you will in downtown Aspen, as you will in Basalt. And, even to the edges of the county and, Redstone and the smaller entities as well. And so the idea there is just to really put the onus of that message on us, rather than, let's say, the small mom and pops or the the restaurant owners or the retailers. If it's about mask requirements, then it's coming from us, this unified entity. And so what we're doing is creating assets that all of us can share, and we can all size out and push out as needed. So we'll have our mark, we'll have our informational signage and communications graphics, and then lastly, we will also have more of a campaign look and feel to be a little bit more inspiring to the community and the visitors that can help them understand why this is so important to us, keeping this community safe and open. And it might be similar, in spirit to the kinds of things that you saw this summer that the city of Aspen did. Mitzi Rapkin did such a great job with, if COVID were a bear, you'd give it 6 feet, keep Aspen from having to hibernate, right? And so it's that type of messaging around being a little bit more inspirational. So we are actually, we're doing our design kickoff today. We're planning to have a fast turnaround from the designers so that we can all have graphics that we can push out starting as early as 2 weeks from now and run throughout the season with great consistency.
Thanks, Virginia. I just got to say, I'm really excited about this collective. It's got a ton of tremendous brain power behind it and doing really good work for the community as a whole. So I'm really happy she was able to join us today and excited to work with Virginia again because I have missed her on the team. I
Thank
think
you. I should mention one more thing, actually. Kara Silvernagel very, very kindly actually put in a grant proposal for us, and we were awarded a grant that we collectively will use to fund this campaign. It's from the NWCCOG, and we, Go Snowmass, are administering that grant on behalf of all of the entities you see here.
Yeah, thank you for remembering to do that. Kara was on fire getting us this grant, and we're excited that we're in this space. And I think, Virginia, can you stick around in case there's questions after we finish? We don't have that many comm slides. Okay, well, go ahead and take me to the next one. All right, so if you haven't seen it, but I hope you have, we've started our Rule Out the Flu campaign. It's a robust 6 to 8 week campaign that has all those assets happening around newspaper advertising, digital advertising, streaming on cable TV, social, paid social advertising. And honestly, with the paid social we've done already, which is a pretty inexpensive vehicle, we've already had about 16,000 impressions on this campaign, which says a lot about how it's getting out there. We did hear from the immunization task force that there is some places that are already having shortages of the high dose immunization for flu because they are getting so many people going to get immunization. So that's good news and bad news. There's obviously going to be updates on the website about where to go to get flu shots, and when there's clinics that are going out to communities as well. But again, the best thing to do is keep driving people to our workhorse, which is our website, where all this information is living. So next slide, please. You'll see we also are doing everything we can to translate into Spanish. And so this, again, is a pretty robust campaign that's out there, and it'll have a really high impact for the next 6 to 8 weeks. And one of the things about Rule Out the Flu is we recognized symptoms of flu and COVID could be similar. So that was kind of how we got to this message, to just say, be really aware and don't hesitate to keep doing the things we were talking about in the 5 commitments. All right, next slide. Again, the website, if you haven't been to it for a while, we did an audit of it as our tool, and we've done some real good, some great design to get it to a better space. We, again, listened to what people were saying they were challenged with. We heard that from a lot of different places and have gone in and done some great changes to the design to make it easier to use. Again, it's a tremendous resource if you haven't spent some time on it lately. We shared this picture right here because we've moved over to the state dial from the chronometer, but we'll continue to see improvements to the data documents that we're putting out as well. The next slide, please. Another tool in our toolbox, if you haven't signed up for it yet, is a newsletter that goes out on Tuesdays, usually about midday, where we kind of recap a lot of the information throughout the week that we've been collecting and wanting to be sure to get out as an important information source to the community. And we're again seeing pretty good subscription right here, but could always see more. So we encourage you to, again, send that out to your channels. Dave, I don't know if you're still on, but Jennifer and I caught up, Slaughter and I caught up after a few weeks not talking to each other, and there's clearly more opportunities again to push this information further. So we're working on that. All right, next slide. I wear a mask. Greg, it's not gone away. You can see that we've got a new word in there that says still. So you're gonna see a little bit of a redo on I still wear a mask, and our team is working on that. We're going to start putting some money into it from paid advertising as well, social channels and print advertising. And just again, think this is a good time to just restart this campaign to get people thinking about it into the winter season. And then I believe
shout out to Tom Kirk for that too. Tom Kirk was a big inspiration for that early on.
That's right. Tom, you're probably on here. I can only see 4 of you, so it's always hard to know who I'm talking to in the audience. But yes, this is gonna just see a refresh and continue to get pushed out in our community because we have gotten some really good response to it. So we will, though, when we do this, go back to Board of Health to say, all right, help us get back on your channels to get people re-engaged a little bit more with the conversation. And then I want to say next slide might be Halloween if they added Larissa. There we go. I'm actually going to move this over to Larissa Danino for an update because she did a fantastic job getting us the great tips and tricks that we're sharing out throughout the school districts and all our other channels. So Larissa, I'm going to turn it over to you.
Thanks, Tracy. Yeah, as Tracy had said, our team has been working closely with the communications team to try and put out some information for Halloween. We did receive that guidance from CDPHE, but if you did have a chance to look at it, it's a very long document with a whole lot of words that doesn't make it very easy to understand what the guidance is. So using that guidance and kind of the take that CDPH did, which was based on the county's dial level. So for our dial level, at level 2, they were recommending alternative activities to door-to-door trick-or-treating. So a few of the messages that were very consistent throughout that guidance was really relating back to all of our 5 commitments and avoiding the 3 C's. So we kind of broke it down into 3 components. And so this graphic is 2 of those, which is avoiding the 3 C's, and adhering to the 5 commitments is another graphic that we have. And next slide. And so again, the 3rd component of that was just recommending some alternative activities to trick-or-treating. And some of those activities we suggested were throwing outdoor neighborhood face mask decorating parties with guests limited to 10, going to an open air walk through haunted forest or pumpkin patch, having an outdoor movie night with family and friends, organizing an outdoor neighborhood costume parade, creating a scavenger hunt at home. And so really a lot of these are promoting outdoor activities as well as staying within your neighborhood or your household. And this information did go out into the newsletter on Tuesday. We've shared it out to a lot of our school contacts already. And so we'll be trying to push this out through other channels in the near future. And I think that was all I had. So Tracy, if you wanted to take it back to see if we had any questions.
Yeah, and I don't know if you could take us to the gallery view so I can see people when we're talking about questions or suggestions. One thing I will share, because I had a great conversation, I've had great conversations with many of you, but we keep getting super ideas coming in. And it's not that we aren't planning to figure out how to implement them. We're just trying to figure out where they fit into the strategic plan that we're building out to, again, be a little bit more, I don't know, organized around what we're doing with communications. Kim, I know we talked about the personal story piece, and we're trying to find a way to get somebody that can do some video and help us, you know, kind of guide that. But right now it's just, we're trying to push through to December, I guess, or, you know, or New Year's with what we have on our plate right now. So, all right.
I'd like to add an important symptom difference that you can give between the flu and with COVID-19. 95% of people who have COVID have a loss of sense of smell or taste, and those with the flu don't. So emphasize that.
Great point, Dr. Kurt. We've heard that a few times. That's a great one. Tori.
Thanks. Thank you so much for this. In the round robin, I had planned on bringing up a question for the board about Halloween, and were we going to make any unified statements about a safe Halloween? And I think recently I heard that perhaps the North 40, which is you know, a very popular Halloween route and neighborhood get together over there, I believe I heard that the HOA there sent out an email perhaps that was saying no door-to-door trick-or-treating. I don't know for sure. I'd heard that. So I was just wanting to bring that up. How do we feel? Are we comfortable with this campaign around Halloween? Did we want to do something stronger? Are other people, is the community looking for additional guidance from us? I just wanted to bring it up. I don't have the answers, but it was something that I wanted to touch on in the round robin.
Yeah, thanks for bringing that up, Tori. I forgot to mention about the North 40. They did release a statement that they were not, the homeowners were not going to be handing out candy to trick-or-treaters this year. And the North 40 was great and actually reached out to us for some guidance. So that's when we were able to provide what the state had given us. So yeah, I think that touches on that part. I'm not sure about if we're going to want to release a more firm statement on Halloween, but
I'll be the first to admit that my finger is not on the pulse of trick-or-treating. So I really look to others if if there's any other insight of what we should do to have the safest Halloween we can. I'm just bringing it up. Thank you.
Tori, since I'm here, I'll speak not so much as a marketing person, but as a mom. I think that we have the great benefit of Halloween being on a Saturday this year, meaning people can do things during the day when theoretically it'd be warm enough to be outside. And I think that that's one of the important things that was brought up before about not being indoors together. I think it's going to be a really big challenge for us all this winter. We're all trying to solve for it. But if there are opportunities for people to do things outdoors together, I think that would be something would be really worth encouraging. Rather than, because the alternative that everyone's talking about, in terms of parents is like, well, then let's just throw a Halloween party, which means everyone's just inside, which we certainly don't want. And I don't know if it's worth doing a Halloween parade, and maybe that isn't the right kind of gathering limit, but encouraging people to be downtown in costume during the daytime rather than at night.
Tracy, could I jump in?
Yeah, go ahead, Patty.
Yeah, I think running that slide that has the 3 C's on it, if you could print that and put it in the paper, I think that is a great way to tell people. I think because people are calling me, asking me what the guidance would be for Halloween. I live in a small neighborhood. They're wondering what's happening. People throughout the community have been contacting me, and this is great help for me. So I think if we could get that slide out there, encouraging people to do those things. And she's absolutely right. Let's take advantage of the daytime, be out and about, whether you're just walking through town with your costume on. The best thing about Halloween is masks. So, my daughter's having a masquerade get together with family, and we're all designing our own new fancy masks. And we'll definitely do pictures for the selfie pictures for I Wear a Mask.
Great. That's a great time to give us some new material to work with. I can share with the team that one of the things I hear our team being concerned about is not even so much the trick-or-treaters or the little kids. It's the informal parties that young people might consider having. And so we are definitely going to be starting to push a lot more social messaging, and we can definitely get something in the paper here to just, again, try to encourage folks to be doing the safe thing around this, Halloween, which we know is not how we are used to celebrating it in Pickens County and Aspen.
Thank you very much. We're going to move on unless there's any other burning questions. And next we will be looking at the data update. And Josh, thank you very much, Tracy and the team. Good presentation. You're working very, very hard, and we truly appreciate it. So thank you. Josh?
Yep, I'm here. Thanks, Marky. I'll try to fly, I promise. Next slide, thanks. So just real quick, when we're looking at our case counts here, we've seen a steady and significant increase in cases over the past about month and a half. So we have begun to reach a pretty high level of cases here in Pickens County, and this is being seen statewide, nationwide, and then of course region-wide. So the top graph here is United States epi curve, so the number of cases by day. You'll see that it's increasing, and then our epidemic curve is pretty closely mirrored to what we're seeing across the country, with that increase really starting in mid-September and now reaching the highest point that we've seen since mid-August or so. Next slide. These are the number of tests that we have been doing here among Pickens County residents. So not just AVH, but total Pickens County residents who have been tested. And then the red line is our positivity rate. So what I wanted to point out about our testing is that we have been doing a lot of testing recently, thanks to all of our partners in the community. We've had a significant number of people tested, and I'll share the exact number in a few slides. But you can just see that the number of testing has really grown since early August, and a lot of people are being tested in our Pickens County residents. And our positivity rate, though, even given that our testing rates or numbers are going up, we're seeing an increase in our positivity rate. So we're very close to 5% right now, which is kind of that threshold that we like to stay under. So we've seen that positivity rate grow since about September 24th. And so we're pretty close to 5% at this point. Next slide. And then I want to just show you this to kind of emphasize the work that's being done by our contact tracing team. Right now, we have 18 individuals who are currently in isolation. And as of last night, we had 143 that had been quarantined, and that's up to 161 as of today. There's more individuals that are being contacted. So we have a lot of individuals right now who have had exposure to COVID-19. So there's been a lot of different events and moving parts and different scenarios and situations in which people have been exposed. So there's been a lot of activity recently. Next slide. And then again, just an update on our Hispanic and Latinx cases. We were seeing these decrease for a while. So from early August to late September, we were seeing the percent of cases among Hispanic and Latinx individuals decrease. We have seen that increase again, starting around September 25th, and now reaching about 24 to 25% of all of our cases are among the Hispanic or Latinx community, compared to only about 10.5% of the population actually being Hispanic or Latinx. So we're seeing about double the number that we should be seeing in that population. Next slide. And then this is something I just want to share real quick. This is a large cluster that we had been working on. So this is not one outbreak, but it's a whole bunch of cases that we've connected together. And so I just wanted to show the board just the work that we've been doing on the back end to try to connect cases and make sense of things. And so each of these pink boxes is a confirmed case. And then the yellow boxes are probable cases. So they were either tested negative, but they had symptoms, or they were not tested, but they still had symptoms and they were exposed to someone with COVID. And so this all started with an individual that had attended a funeral, and then it really just blossomed from there. And so you've seen a lot of cases connected back to that. We think that it's done and that it's over at this point. We're not seeing any more cases grow from this cluster, but did want to show that one case can lead to a whole bunch of other cases pretty quickly and pretty significantly. And it does take up a lot of time to try to track all this down and make sure that we're containing it as best we can. So I just want to share that with the board just to show one example of a cluster of cases that we're working on. Next slide. So then just a few trends and notes real quick. Our 14-day rolling average has been increasing for the last month since September 14th, and our cases are up 60% from the previous 14 days. So if you look at these 14 days compared to the previous 14 days, we're up 60%. Our positivity rate, as well as I had shared, has been increasing since September 26th. We're almost at 5%, as I mentioned earlier as well. And then significantly, our community spread has increased from 10% on October 1st to actually, I think we're at 38% right now as of this morning. Again, community spread is percentage of individuals that don't have a known exposure. So that tells us that there are more cases in the community that we're not aware of. And so we like to keep that number as low as possible. We brought it down to 10% on October 1st, but now we're back up to close to 40%. This is a similar trend, again, that's being seen region-wide, very high levels of community spread, meaning that there's a significant number of individuals out there who either aren't getting tested or we're not aware of for one reason or another. Right now, we are currently investigating 5 separate outbreaks as of this morning. The sizes of those outbreaks are, we have one is 2, another one is 2 or 3, and then we have one that's 9. And so this is the most number of outbreaks that we've had at any one time. So while 4 of them are relatively small, they're still considered outbreaks that we're working on and trying to contain. As far as testing, we happy to report that we've had 1,219 Pitkin County residents tested from September 14th to October 13th. And these are individuals that claim Pitkin County as their residence. So some of these might be second homeowners or others that may not be permanent residents, but they are stating that Pitkin County as being their place that they're currently living. So a lot of testing has been done. And then those are the numbers below that have been done per city. So you'll see Aspen's at 904, Snowmass, which includes Snowmass Village, 266, Woody Creek 31, Redstone 10, and Meredith 8. Next slide. And then just a few concerns that I wanted to point out that I think have been discussed by our communications team is the CDC is warning that the increase in cases is largely due to small household gatherings. And so one of our outbreaks that we're working on is a small household gathering as well. And so with Thanksgiving coming up and colder weather expected, in the next few months, we think it's really important to continue to emphasize that, these small gatherings are a source of infection for an increasing amount of individuals. So a few notes are Halloween and Thanksgiving. We know that, we're going to see some gatherings around there. Colder weather, as I just mentioned, means more people are going to move inside. Increased travel, of course, is another concern for an increase in cases. And then, of course, cases are surging worldwide and nationwide. So we have a lot of different factors that are playing into these increasing case counts that we're seeing here and statewide and, of course, nationally. And the last slide. And the final note is, again, just to get your flu shot. With flu and COVID co-circulating, the concern is always that hospitals could more easily become overwhelmed. And then I just wanted to point out one thing that some virologists have been mentioning and probably circulating around the news, is that some virologists are suggesting that live virus vaccines, such as the flu mist, may provide some sort of protection against COVID. Of course, there's no actual evidence that that is the case, but that is some of the word that's being spread around right now. And so flu mist is it's a nasal vaccine that's approved for people ages 2 to 49. So I just wanted to point that out, and that's something that of course it should be discussed with your PCP or pharmacist to determine which vaccine is best. But just wanted to make that known to the Board of Health that there is a discussion out there that this vaccine, flu mist, may be in higher demand because there is a lot of language and communication out there about its potential to provide some sort of protection against COVID. Of course, there's no evidence for that, and it's also the longevity is not really known for that either. But we know that that is true with other live vaccines, that live vaccines may provide some sort of protection against other viruses. So just wanted to point that out. And I think that's it for me. So I'll pass it off to Dr. Levin.
Thanks, Josh. I'm going to build on and emphasize everything that Josh has just been discussing. I'm going to talk a little bit about how everything is reflected in on a state level, and then look at some of the AVH, Aspen Valley Hospital data that reflects this as well. And it's a very, very concerning steady increase in cases since the middle of September. We initially thought that this would probably be a bump from Labor Day weekend, knowing that holidays bump our cases. But what is happening, what we're seeing, is not only did it bump, but it bumped and then continued to rise steadily since mid-September. So this is just a bigger view. What has happened nationally, it was in the Northeast, then the Southwest, and now it's really shifted in the Midwest and the West and around us. So this shifting landscape. Next slide, please. And these are kind of my key points, and I'll show you our data, and I'll go through the next slides pretty quickly. But the cases among all age groups are steadily increasing since mid-September. Again, our original expectation of a Labor Day bump is not what's playing out, that this is actually a continued steady increase. Hospitalizations in Colorado have reached its highest point since May 31st, which I think is very significant. Although we don't have any cases right now in Aspen Valley Hospital, our sickest people are transferred, and so we would contribute to this overall hospitalization rate. Number of active outbreaks are at an all-time high. This is what Josh was talking about. It's nationally, it's on state level, and it is locally here. And a lot of these outbreaks, again, are these small, which Josh mentioned, these household gatherings. So it is really important to know about this. This is what's driving an increase in our testing as well. And my perspective is, unless cases stabilize and start to decrease in the next few weeks, we may be in a very difficult position going into expected holiday surges in winter season, which we've all been talking about. So next slide. This is state data, and it just is a great picture of what's been happening since March. And if you look at over the last month, there is such a sharp and high rise that far exceeds what has occurred during the entire pandemic. And this is a 7-day average of COVID cases in Colorado. So we've hit the 800 day mark, in 7-day mark. Next slide. This is a slide, and this is all from CDPHE, a website, by the way. All of these slides are from the state data, and it just looks at every age group. So if you look at all of these different colored lines since the middle and beginning of September, they have all increased steadily, every single age group. And the top one, the sharp rise of the 18 to 25-year-olds, which we have seen have contributed to a large number of new cases. As mentioned with Halloween, it's going to be really important to decrease informal gatherings, especially among this age group. Next slide. And then current patients hospitalized, that we have seen the highest number of hospitalized patients since the end of May in Colorado. Next slide. And I thought this was worth looking at. Right now, the state is estimating we're at about a 50% social distancing. If we stay at this green trajectory of a 50%, our observed number of current hospitalizations are going to rise very sharply and continue to do so throughout October. Next slide. And then this is just outbreak data on the state level. Again, the main message here at the very end is that we are at an all-time high of outbreaks. This kind of is very colorful and is broken down by what type of outbreak. I think Josh's local data is the most important for us, but really we're looking at schools, we're looking at bars, restaurants, and indoor office workplace breakouts, as well as congregate facilities. But I think it's very concerning what we're seeing here in October statewide. Next slide. AVH, this is the AVH matrix. We remain in cautious level, and that again is due to the number of tests that we're doing at the community testing site. We are maxing out. Initially, we set this level at 16, which would move us to cautious, and now what we're seeing is that we're actually over 30 a day, that is. Next slide. So this is AVH data. Currently, we don't have any hospitalized COVID-like patients, but we have had a few in September. Next slide. So that's inpatient. Now the emergency department is still seeing kind of a steady rise throughout September and October. And we've gone over our limit, which would bump us into the cautious phase of six patients a day in the emergency department with COVID-like symptoms. So we're really hovering right at that now, consistently. Next slide. This is the Respiratory Evaluation Center data. And again, this is the Respiratory Evaluation Center was originally set up for people who have symptoms and had more moderate symptoms and need to have a physician visit and have a test. These data, interestingly, is well below what our cutoff is of 10. And I did speak with Alyssa Franklin, who runs this center at the hospital, and she feels some insight into this is that they have now started doing a lot of telemedicine visits, and there's been 78 telemedicine visits in mid-September, which I think are not included in this data. So now what we're seeing is a selection of just sicker people who are being seen on site, and the people with mild symptoms are doing telemedicine consults. So I think that really explains why this hasn't bumped up, because the data really has changed to a selective group of sicker patients, still consistently being seen. Next slide. And this is the community testing site, which is the numbers that have put us into the cautious phase. And consistently since beginning of September, we've been above the 16. There was a record on Tuesday, just 2 days ago, a record high of 37 tests done. And today, when I spoke with her early this afternoon, we're already at 33. So this demand we think is really coming from the outbreaks, and working very closely with public health and trying to identify as quickly as possible these cases. So again, this testing conversation is a response to this, that we're maxing out here and that there is an additional need, and a lot of work is being done to create additional testing sites in the community. Next slide. These are employees out with COVID symptoms. There's 3 right now out at Aspen Valley Hospital with COVID-like symptoms, which is below our level of 6. And last slide, I think, the next one. This is just the total weekly positive and negative tests. So we have been doing a lot more testing since the end of August, consistently going up. And this is all kinds of testing in all of the sites that I mentioned, as well as asymptomatic preoperative testing. I think that's it. Thank you.
Thank you very much, Josh and Kim. All I have to say is yikes. we have got, I don't know what to do, but we've got to stop this trend.
I think the term a third wave is what we feel is coming, is what we're in.
And we here in Snowmass at our budget meeting this morning, we have got to stay open. I mean, and this is really tough to crack when we know ski season is on top of us and tons of visitors coming in. So we as a community must get our arms around this and really work together to bring this down. And Greg, you have something to say, and then I'm going to move on because we're 15 minutes behind.
Just very briefly, a term that came up in this presentation, either Kim's or the previous one, was about family spread, I believe. And I think that's a new term, like community spread was, and social distancing was before that. So as we start talking about family spread, as we go indoors, I think that would be an important one to get out to the public, what that means and what the implications are.
Very, very true. We need to really get our communications team on that one as well. My goodness, there's so much going on. We're going to move into tips and recommendations. Larissa, I think this is going to be you.
Yes, you can go to the next slide. So you said it exactly right, Marky, yikes, of kind of where we're heading. So we wanted to just remind everyone of kind of what those community priorities that were identified for moving into the winter season. And, you know, those were getting kids back into in-person learning, increasing transportation capacity, the tourism industry and economic activity indoors, and keeping that restaurant capacity and the ability to have gatherings. Next slide. So this is something that we developed kind of in response to noticing these trends and where we're heading. And really this was meant to just communicate to our entire community of what the potential implications are of us having to move from a safer at home level 2 to a safer at home level 3. So we're rising that way. And so we wanted to be fully transparent with our community and get everybody on board with taking some preventive actions to hopefully prevent that from happening, and stay open, as you said, Marky. So the table here indicates the different sectors and what that would mean if we did have to move down to a more restrictive level. So for instance, the restaurants, they're currently at 50%. That capacity would have to be reduced by half to 25%. So as you know, that would be a huge, have a huge impact on our restaurant industry. So for each of those sectors, we tried to provide some type of preventive action that they may be already doing, but might consider doing additionally. So for the restaurants, maybe considering just offering and promoting more curbside or takeout service. And, you know, places of worship, potentially hosting virtual gatherings or more virtual gatherings versus in person. So we really tried to just start sharing out some preventive actions to the community so that we can all be on board to keep moving towards those community priorities. And next slide, please. In addition to that, we wanted to come up with some preventive actions that everybody is already aware of for the community in general, and just remind everybody to stay vigilant and follow the 5 commitments and avoid the 3 C's, especially as we're approaching all of these different holidays. And, you know, reducing the number of times you socialize with non-household members. Informal gatherings are still limited to 10, but consider limiting those activities just to your household members. Working from home if you're able to, and staying home if you're sick, even if you have just a minor symptom that you think may not be related to COVID. And then encouraging others in the community to take some preventive actions and stay vigilant so that we can hopefully kick this in the butt now and still have a successful winter. And I think that's all for me. So if anybody has questions, comments.
Any questions or comments? You know, you put that chart up there, Larissa, and it's scary.
Can you go back a slide, Raleigh,
Yeah.
please?
Yeah, that
There you
is,
go.
you know, that might be kind of a warning if we get that out on our website. in our newspapers and on our social media. This is what can happen here. Not to put the fear of God in people, but we've got to get people to start wrapping their arms around what I call COVID fatigue.
Yeah, and Mark, that's exact. Oh, go ahead, Larissa. Sorry.
Oh, go ahead, Cecile.
I was just going to say that's exactly the message that our team's wanting to get out, and Larissa and her team has been working hard to get this message out to the business community, and then our communications team has been getting this out more broadly to the general public, that we really need everyone to pitch in to get us moving in a different direction. And with COVID, as we've talked about early on in the pandemic, we really see the impacts of the actions that we take today, 2 to 3 weeks out from now. And so in order for us to be able to have a successful fall and winter season, we really need to start buckling down a little bit more and having everyone participate and recommit to our 3 C's and really being cautious with our 5 commitments in order for us to be able to.
Thank you very much. I'm going to move on to our next discussion, which is winter planning. It all goes hand in glove, and I know we have John Peacock and Kara on this one. So John or Kara?
Sorry, I'm just having trouble getting to my thing here. So my update is really around the state. The state did issue draft guidelines for ski areas. They're taking public comment on those until tomorrow morning at 10, after which time they will be finalizing those. We have been working with a locally, of course, with the municipalities and SKICO on winter planning, and been tracking what the state has been doing throughout. So ski company will be in a position, we believe, to submit their plan in compliance with the state guidance fairly quickly after it is finalized. With that, Kara, did you have, and Suzuho just put the draft, a link to the draft guidance in the chat. Kara, did you want to add anything?
No, I think it was mostly on the state guidance that has come out right now.
And Marky, we'll try and get you caught up by not taking too much time here, but if there are questions, we'll be happy to answer them.
Any questions? I did read through those last night. There's a lot of work that goes into getting our ski mountains open. So I encourage everyone to click on that link. It helps you understand the level of detail that SKICO has to go through to get our mountains open. Wow. Okay, any questions? I don't see any hands going up. Suzuho, do you see any hands going up?
I don't know.
Okay, well, let's move on. Kurt, you're going to put, Kurt, I think we're back with 6 minutes ahead.
All right. Wow. No pressure here. So thanks, Marky. I'm here today to talk with you about environmental health fees. I feel like I should apologize to use the Board of Health because of all the public health subjects outside of COVID. I'm bringing fees to you, which just isn't that fun. So thankfully you can't throw tomatoes at me virtually. But I'm bringing this forward because we had some changes done with the state statutes recently that allow us to charge cost recovery fees for our OWTS, which is on-site wastewater treatment system, or septic, for those who aren't familiar with that term, permits. And this is an ongoing effort. I think Commissioner Child talked about it being at least 3 years. This was identified as a priority last year for CCI to look at the statute for the OWTS permits and modify it. There previously was a $1,023 cap limit. As a department, we've been at that cap for new permits since 2008. And a number of other departments around the state have all been at that cap for probably about 10 years. So we have been lobbying to have that changed. It was changed earlier this year in legislation, and so we have started the process of looking at our fees. What I have before the board is a proposed 2020 fee schedule for all of the department fees, not just the OWTS. We last went forward in front of the Board of Health in early 2018. That was when it was the Board of County Commissioners acting as the Board of Health to amend fees. So we felt like there were a few other fees that we needed to change along with the OWTS fees. In the packet, I attached 2 spreadsheets that talk about estimations for the cost recovery for our new construction permit. And the new construction permit is the permit that we spend the most amount of time on. We have 2 site inspections that we do with that, as well as reviewing the actual design. And that is, in our proposal, the largest change that we're proposing. The previous fee was $1,023. We're proposing $2,023. When you look at what our cost recovery is, we have 2 separate spreadsheets that estimate about $2,300 and change for each. So what we're proposing still isn't close to what our costs are for the permit, but we also felt like $2,000. We're doubling the fee essentially is what we're proposing, and that's a sizable jump, even if we've been at that since 2008. So we felt like this is a place to start, and then in the future we can continue to address whether or not we want to increase that. But for now, that seemed like a good landing place of not jumping way too much. So Raleigh, I have can I go ahead and share my screen? I'm gonna just go through really quick here. Thank you. So can everybody see my screen? Thank you, Suzuho. All right, so what I have here,
zoom in
a
if
bit.
you can, make it bigger.
Yeah, see if I can. I am not on my typical laptop. I am on a little Surface. So is that useful? Does that help? Yeah, okay.
That's better.
All right, so the fees, this is the proposed fee schedule. What I have here, anything highlighted in yellow is a change from 2018. So we talked about the new construction permit going from 1,023 to 2,023. We thought it best to change our reactivation from a flat fee to an hourly rate, because we have some reactivations that do not take but a half an hour, and we've had a few where they're submitting additional information that takes more than an hour. So it seemed more fair to charge an hourly rate there. Our use permits were $100. We're proposing to go to $150. The minor repair permit, we have not started our minor repair program, but that is a program that we are hoping to get off the ground in the next year. That previously, there was not a fee associated with it. But because of the administrative duties around that, we felt like we should at least have a minimal $50 charge just to pay for the amount of time we'll have with administration for recording information. The renewable permit that we have, those are for systems that require maintenance. And if you require maintenance, then we want to make sure you're maintaining your system. So we have a renewable permit program that we need to also get finalized, and we propose to change that from $100 and $150. The other change under septic, under the OWTS program, is that we included additional inspections beyond the ones that we typically do with a new permit application. So we have a number of systems, and especially large systems, where people will have partial inspections done. So we go out, we inspect a piece of the system, and then we go out again to inspect another piece, and sometimes we get up to 5 inspections. So not everybody is that way. It didn't make sense to just try to incorporate that into the permit, but we want to charge for those each additional inspection, so that we're recovering our cost. And those come up especially in the larger systems where we have people who want to let us look at the field to bury the field, and then they still have other pieces that we need to look at. So that should help us with addressing those costs. The other changes that we made, we removed the costs associated with retail food program. Those previously were in our fee schedule for 2018. Since the state has that program along with the schools and child cares right now, we've removed those. And then we have a noise program and a permit for a variance that we had not previously been charging for a permit. So we were proposing to go ahead and charge for a permit. Again, we wanted to do an hourly rate because the amount of work we do on average is different for each permit. Some permits are very simple because they're yearly annual permits that, as an example, the city of Aspen will get when we do the Uller Fest or when we do the New Year's celebration. So those are typically no changes, and they're pretty quick, and so we can charge, a half an hour at our hourly rate. The other one, knowing that there are still plan reviews that we would participate in, the best one I can give an example of is if we do a review of a pool to assist the community development department, we would want to be able to do some cost recovery around that as well, since there are state pool regulations and we want to review for the compliance with those. So those are the proposed changes we have right now. I brought this to the Board of County Commissioners on last Tuesday, to discuss prior to the Board of Health to get their approval to move them here for final approval and adoption. The couple of things that came up with the county commissioners, they agreed, the majority agreed to move them forward as is to the Board of Health, but there were a couple of concerns that were brought up. One had to do with the flat fee and concerns around, are you spending more time with larger systems, and should you be doing some type of sliding scale based on system size? In reality, the amount of time that we spend on any one of these things is fairly similar regardless of the size, because we have 2 site inspections that we have to do, and then the review of the actual design. The engineer who does the design is doing the majority of the legwork, to where we're just looking at the design for code compliance. So there's not a lot of time spent there. Where the big difference is really back to those inspections. Those large systems, a lot of times we split those out. So we already feel like we're capturing those differences by being able to charge, again, in this proposal, for additional inspections beyond what we have. So that was one of the concerns that the county commissioners had. The other was the size of the jump from 2023 to 2023. And one of the comments was whether or not we had thought about tiering the system, and I'm going to bring an example. I don't think we brought a specific example, but we set our minds at $1,500 this year. The following year it's $1,750. The following year it's $2,000 is what I heard. And Patty, I think you're the one that brought that forward, and if you want to elaborate, but that was one of the questions that I think you brought forward around whether or not we should tier it. And I think you're here. I thought I saw you were on. Did you want to talk a little bit more about it?
Yeah,
thank you.
I was the lone voice on the BOCC about that, just because it's a significant increase. But the fact is, we haven't raised the fees for so long. That fee since 2008, Kurt? That's when it was capped by the state. It's just, that's a big hit for people to come in with, doubling the fee. So I was thinking, do a 500 this year, 500 the next, and then reevaluate, and then maybe bring it up to the actual level, which is more like $2,400 or $2,323. But I was kind of outweighed by the rest of the Board of Commissioners, who said, since it's been so long, we should just take it to the 2023 rate. But that was a concern of mine, and I don't know where the Board of Health wants to go on that, but that was a discussion that we had on Tuesday. And thanks, Kurt, for letting me have that opportunity to express my lone opinion on that.
Kurt, can you go back to the top of the chart?
Absolutely. And, so I think that's really the end of my presentation, and I wanted to spend some time with the open floor for discussion.
Well, you know, Patty, I really appreciate your comments. When I look at that $2,023, these are new permit applications, and would appear to me, if I were a developer or a single family home being built, I would have baked this into the budget, or will bake it into the budget. I wouldn't be building if I didn't have the money or have the loan application in. So
Yeah, that's true, Barky. But if you're building a 15,000 square foot house, you're paying 2,023. If you're building a 2,500 square foot house, you're paying 2,023.
same amount of work is what I'm hearing from Kurt.
Well, but not the same amount of budget.
And Marky, one other thing for clarification, if you have to repair your system and it's a full system, you're still applying for this new permit. So if you have an existing house, it would still be 2023. So it's not fully the developers, which was one of the considerations. It's also if you have a full system being repaired. Now, if you only have a portion, then it's not that. But if you have a full system you have to replace, then it would be.
And how often do you have a full system repair?
We talk about the average lifetime of a system to be somewhere between 20 and 30 years, depending on how people treat them. There are examples of shorter and longer. So, and we have a use permit program, and part of the reason we have the use permit program, that's where we have people have their systems inspected to make sure that they're in working condition, either when you sell the house or when you do a remodel. And the intent there is to capture anything that might be a concern so that if we have small problems, we fix them before they become a bigger concern, both for water quality reasons and for the homeowner, because a big repair is obviously much, much more expensive than doing minor repairs and helping to extend the lifetime of that system.
Thank you very much for that answer. I see Greg's hand.
Yeah, just to say that I did appreciate what Patty brought up in our meeting. I didn't mean to disagree with you, Patty. And I don't think I did. So yeah, you weren't the sole voice. I think you made a good point. The concern I brought up was that if somebody does have a failing system, I don't want to disincentivize them from reporting it and getting it sorted out. And that's what I was concerned about. If the cost of going through this process is too great, will people with failing systems hesitate and put it off as long as possible? And that's one of the concerns, the unintended consequences of doubling the rate. So, and Kurt did bring that up. I just want to mention it again and give him a chance to explain that.
And I think, you know, I think that's a part of the concern why we have it. It certainly seems like a lot, even though we're still charging under what our cost recovery is. And I think they're very valid concerns that as a department we discussed, does it disincentivize? And I think there are opportunities for our department hearing those concerns, especially from the board, that I think we need to get out in front and not just utilize the use permit program, but probably just annually do some advertising and some work with in the community to bring up some awareness and raise the awareness for folks that, again, the better you treat your system and the more you do maintenance and regularly check on it, pump your tank, the longer it's going to last. And that's an important piece of all of this too. It's something that we do, but I think we probably want to do a more active job, especially knowing that concerns are found. We don't want to disincentivize this.
Kurt, just a quick question for you.
Mm-hmm.
Is the expectation they pay $2,023, or can you do a payment plan over a year or something like that?
That's a good question. We haven't allowed for a payment plan, and the way the statute reads, payment is due up front, so we would expect this when they're paying. You know, we have looked at, but I have not come across another environmental health department. We had looked at the idea of a sliding scale previously, back pre-COVID, when we knew that we were talking about fees. The problem is that environmental health departments are all charging what their cost recovery is. But so the idea of a sliding scale would be something very new that we would have to really think about. But it's certainly an idea that's intrigued us. I just don't have another example to go off of because people are really interested in cost recovery for the program.
So what does it, so you say we're not recovering our costs. What is the cost?
So based on the calculations, it was not quite $2,400. I think one was $2,350 something, and the other was $2,381. It was in the AIS. So they're just under $2,400, and we felt like that was just too much of an increase to go there just immediately.
Okay. Let's see. The board is other people on the board. If we can go back to seeing everybody, that would be very helpful for me.
Yeah, I'll stop sharing my screen.
Any other hands going up? Suzuho, see anyone? No. Okay, I'm going to be looking for a motion to approve staff's recommendation on these fees. I don't see anyone willing to put their hand in. Hey, Greg.
I'll second.
I'll second.
Okay. We have a motion. We have a second. Any further discussion? All in support, raise your right hand. Okay. The next item on our agenda is round robin.
Thank you.
I may have 3 minutes. I'm proud of myself. It's really John Peacock helped me here. So a round robin. Who would like to go first? Tori?
Surely. Thanks. I am so appreciative of what we're hearing about testing initiatives. And my question to the board is, while testing seems to be ramping up and becoming more accessible and more available, are there other measures that we would want to be putting in for the winter? The one that has come up at the council table was some sort of, and I think Greg and maybe even Kim talked about a little bit, a declaration, for incoming visitors, a declaration of awareness of our health and safety policies, or a declaration of health. Right now in our health orders, we have a mandate to be symptom-free for 10 days before traveling to the Valley. And I'm just wondering, are there conversations going on with ACRA or lodges or any other entities that talk about a declaration of health and safety and awareness of the codes that are here? And I really put that out as a question. Would that be a helpful measure? Would that added awareness and imparting that awareness to our visitors be a benefit and a step forward? I just wanted to bring that to this board because I see that if testing is to be ramped up, if our contact tracing is to be ramped up, we seem to be creating a safer environment here and one in which we can continue to maintain safe entry and exit in and out of the community. So I just bring it up for a question for the board.
Suzuho, do you have an answer on that? I know we talked about a little bit this morning during the marketing and tourism discussion on budget here in Snowmass and what the lodging community is doing. I don't remember it including, of course I left early. Bill Madsen might know. He stayed about a couple minutes after I did, but they're really ramping up communication with all of our lodging opportunities here in Snowmass.
And I just want to remind the Board of Health, we did approve at the last Board of Health meeting for the new public health order that started on the 7th, I believe, is that lodging is required, or anyone who's taking reservations from visitors are required to notify visitors of all of a new thing that started about a week ago.
Brent?
Yeah, just to Tori's point, and I think it's a good one, and just that, again, you know, I think marketing is everything, and I think that there are thresholds as you come into this town, especially the airport, the entry, you know, at the S-curve or the roundabout, or really the S-curve, say, and then the hotels and the various management services. And I think that's the first interaction that anybody's gonna have, right? They see the sign, they come into the airport, and we just need to make sure that that's effective, dramatic, and clear. So.
Okay, anyone else? Greg, did you have your
If I
hand up?
could, Suzuho, I'm sorry, you broke up for me when I had something beep, so I didn't quite hear your answer, but I've been talking about an affidavit. I've been talking about a commitment from a visitor coming here. And when I see marketing or I see outreach or, you know, inviting them to participate, it's like, no, I'd like to see them sign a piece of paper that says they'll be liable for their hotel expenses if they have to quarantine. If they're coming here, they've got to show us evidence of a test in advance. I think by the time they get to the roundabout, it's too late.
And I think that statement's a great statement. I think I totally agree with you, Greg, because even if something like that is, you know, legally questionable or difficult to enforce also and so forth, so what? It calls attention to it. It says we are serious, and people don't want to spend money needlessly. And it also kind of points the liability that's sort of inescapable if they're going to not behave properly. So I think that's not a bad idea at all.
Well, in the state guidelines for the ski industry, it does hold the people accountable for paying any liabilities that occur as a result of COVID.
Well, just some more reminder of it, you know, more direct as you enter into the valley.
John, I know you have your hand up, and then Patty.
Yeah, and I just wanted to add, I sat on the workforce for the state guidelines, and we did encourage the state to consider those same requirements for all lodging as another way of getting at those visitor requirements. My understanding is they're looking at that separately.
Patty?
Yeah, I know there's other jurisdictions that are doing exactly that. For some reason, Avon jumps out at me, but we can track that down. They already have a form that they're using in hotels that people have to sign when they come in. And they also do educate them when they make their reservations. These are the requirements. And then when you get here, you'll sign an affidavit. So maybe we should just reach out and do a little work. I can do that through Northwest COG maybe. Send something out to our region. I can do that today because I'm going to call anyway. See if we can just do a poll, if the board would like me to do that, and see who's using an affidavit of such, and then get copies, and then we'll give them to the Board of Health, and they can decide to tweak it or not, and we can distribute them to our hotels and our lodges and our property managers. And I know that ACRA would be more than willing to help us out with that.
I'll send the same email to cast members and Margaret over at cast and see if there's any communities that are using that.
And who's your Colorado Municipal League? Is Rachel? Who's doing that? Do you guys?
Ann,
Maybe Ann can do that with CML.
Yep.
Perfect.
thank you.
Well, CML was here in Snowmass last night. They're still here, so I could say.
Well, let's just come to Snowmass.
Yeah.
Make them sign an affidavit.
They're from the front range called Denver. And when we talk about ACRA and what have you, we must continue to include our tourism and marketing program here in Snowmass. So.
Right.
Thank you. Okay. Who else has some round robin? Patty, I think you've got support to move forward and talk.
Great. I'll make a call as soon as I get off this. I'll call Northwest COG.
Okay. Okay, any other round robin? Greg?
I'll be quick. I notice I'm taking a lot. I'm raising my hand a lot. I had a question from a parent in the schools about, you know, what are the protocols regarding distancing and how close is Pitkin County Health Department working with the school district? Are they on the Friday principal calls, for instance, where they can clarify questions regarding health policies at the school?
Yeah, I can start with that one, and team, feel free to jump in. But we have usually a few of us, several of us, who are on that Friday call with the schools. And then we also have staff members who are in contact with schools almost daily to support them with guidance if they have any questions with symptomatic students, or what their protocols are, or testing guidelines or anything like that. So we are in constant communication with the schools.
Great. So Zuho, if I could follow up on that very briefly, is if a student or a teacher needs to quarantine, does that mean the entire class has to quarantine? That's the question I was asked.
I'll see if Josh can. Yeah, I'll see if Josh can add to this, but the quick answer is it really depends on the school and their, how they're cohorting their classes. So Josh, I don't know. I know it's really hard to give specific answers to a general question like that because it's so dependent on, elementary schools who have 1 or 2 instructors versus high school students who I think are in 8 different classrooms throughout the day. Or that was one of the plans that was being discussed.
Yeah, I think you answered it, Suzuho. It just really depends if the teacher was there at school while infectious, and if he or she was, then we likely would move forward with quarantining the cohort. But a lot of it just depends on a whole bunch of factors. And then the other piece too is, as Suzuho alluded to, is we have a contact tracer assigned to every school and childcare/daycare in the county. And so they are all in pretty constant contact with each other whenever something comes up related to COVID-like illness.
If I could follow up with the next question from the same parent is next week is fall break, or fall break is coming up. Will people need to isolate, and how long? If they travel out and come back in, are there any guidelines for that going out from the schools for families who may leave for an extended period to who knows where?
Yeah, so I would direct that question to the school because there are some differences in school guidelines depending on which school they're a part of. So public health guideline, again, for us is to really minimize risk as much as possible. And so depending on the type of travel they're doing and their assessment of risk of exposure, would ask that they take the precautions necessary to minimize spread in the community, whether it's through youth groups or the schools or any activities that the family may be participating in.
Okay, anyone else for round robin? So let's talk about the agenda for 2 weeks from now. Obviously, data is very important. Let's hope we're not in a situation to slide backwards. And testing will be on the agenda. Anything else, Suzuho? Perhaps SKICO update or getting our winter planning? John, winter planning, you sit on that task force. We'll know a lot more in 2 weeks from now. Any other?
I've been told there might be some vaccination plan updates as well. So if there is anything, we can definitely present that, but I'm still waiting to hear an exact timeline from the state on that.
Okay, and when does Karen come back? The 18th?
Monday. Mm-hmm.
There you go. Well, I want all of the board to acknowledge the work that Suzuho has had to pick up with Karen out on vacation. I know she worked tirelessly for Saturday, Sunday. We were going back and forth, and I was so impressed with the amount of work of Suzuho and the entire team. Now, I hope you get to go on vacation.
I was going to say, let's send her on vacation now.
Yeah, thank you so much for all that.
Yeah, good job.
A great agenda, a lot of material that we covered today, and I hope all of you are pleased and proud to be part of this organization. It's a great board, and wow, good work. Thank you all.
Thanks for keeping us on track, Marky.
Well, Suzuho is boom, boom. Okay, do I have a motion to adjourn? Thank you, Dr. Kurt. Second?
Second.
Thank you. Support, raise your right hand. Have a wonderful fall day and take care and stay healthy, guys.
Thanks, everyone.
Thanks, Kim, for all the data. Thanks, Marky.
Thank you.
Thanks, John. I hope you're still well with that background.
Thanks. Have a good one. We'll catch up on Marble soon.
Okay, great.
Thank you.